Women with disabilities. During COVID-19 pandemic. How did they overcome this difficult period? Chuluendilgur Bat. Chairwoman, Mongolian National Wheelchair Users. Chuluendilgur sitting in a public place for the first time after half a year of hard lockdown. Mongolia's social security system places the responsibilities of people with disabilities in their families. In 2018, according to our reproductive health survey of women with disabilities, 22% of women who had an abortion because of others' pressure. It was concluded that they choose abortion because health workers, welfare workers, family members, and people living with them demanded an abortion. This means that women with disabilities are not able to make their own decisions related to their own life. My name is Dulam Shuran. I am the Executive Director of the Culture Center of the Deaf. When our participants in the 2017 Gender-Based Violence Survey were asked if they had experienced gender-based violence, 96% had experienced gender-based emotional abuse at some point in their lives. It is unclear whether this situation changed during the COVID-19 pandemic, and no studies are available. Gender-related violence did not come suddenly in connection with COVID-19. This is a real problem that has existed before and will continue to exist. Therefore, our organization has developed a comprehensive guidebook for reducing gender-based violence faced by women with disabilities during the COVID-19 epidemic. This year, Mongolia was under lockdown for many months, almost 6 months, during the winter. Mongolia itself is very cold and unprecedented. During COVID's time, family members would argue when they were at home for a long time, and they would get tired of being with people with disabilities from morning till night. The problem in Mongolia is that there is no place for women with disabilities to seek help, protection, or receive psychological assistance. Akgan Tuya Badamgarov, Executive Director, Bidchadna. 8 p.m. Akgan Tuya's residence, Ulaanbaatar. My name is Akgan Tuya Badamgarov, and I have been working as the Executive Director of Bidchadna NGO since 2013. Currently, our organization is implementing programs to protect the rights of girls and women with disabilities. From the research data of these projects and programs, I understand that for women and girls with disabilities, COVID-19 is not an easy thing to overcome. This is because the government's policies and measures are focused on serving the masses. And there is a real lack of attention to women with such disabilities who live alone, are single mothers, women who have no income. Also, we have a strong gender stereotype. The idea is that mothers must raise the children themselves. As a result, no matter how difficult it may be for women with disabilities, it is very common for them to take on the burden of providing for their families and raising their children. Also, our women with disabilities are not very open when it comes to asking for help when they are being abused. And access issues are very difficult, so no matter how many requests they ask for, they often do not know where to go. We have been under quarantine since November, and people in wheelchairs can't get in and out for 5 minutes, and can't breathe air. This suggests that women with disabilities may be vulnerable to domestic violence or to COVID-19 infection, which can be life-threatening. Leading to fears that they will not be able to access care. There is a lot of stress and anxiety. I am working on 2 projects to protect the rights of women with disabilities during COVID-19. The first project, Zorlog, is an international project that allows women with disabilities to share their real lives online with human rights experts and lawyers, presenting it to us on an online platform and filming events that affect others, etc. This project is going well. In another project, women are planting COVID-19 indoor plants and working as a business group or selling their flowers to improve their household finances. These projects are reaching specific women. It cannot be said that all women's rights are guaranteed. So the government needs to focus on women with disabilities and implement new programs for women with disabilities without leaving out any women. There are many textbooks and manuals on reducing gender-based violence and ensuring gender equality in our country. However, it does not specifically address the issue of women with disabilities. We have tried to solve this problem with this guide. This is the specialty of the handbook prepared by our organization. This handbook provides an overview of the activities of organizations working in the field of gender. It guides how to integrate women with disabilities into the organization's culture, strategy, and plans, and on how to improve the way they communicate with women with disabilities. For the last 4 years, we have been working exclusively on the rights of women with disabilities. One of the most effective activities of our organization is the establishment of 9 support groups for women with disabilities and the capacity building of more than 120 women. As each group became more organized and its capacity improved, the results were seen. No one understands the problems of women with disabilities other than us. So we are working together for our rights and giving our voices. We, women with disabilities, are striving to reduce the problems faced by women with disabilities and gender-based violence. However, these efforts will not directly reduce or eliminate gender-based violence. Therefore, we want the government to pay attention to the issue of women with disabilities. Leave no one behind. This film is produced by women with disabilities, with no prior filmmaking experience.